Hello everyone, welcome to Hornbill TV. My name is Paulami. Today we are again at Swagat Hospital, Guwahati, Assam. Today at the onset, we have the man with the magical healing hands is none other than Professor Dr. Subhash Khanna, is also known as the first robotic surgeon of entire Northeast. Sir, a very warm welcome to our show today. It is my immense pleasure to have you here. To be sitting in front of you again. Today, I and our viewers would like to know a few things about liver transplant. Sir, tell us something about Swagat Hospital and the specialist services you provide.
At the outset, I thank Hornbill TV for inviting me again and for giving this coverage to the Swagat group of hospitals. Swagat was born in 2000 with a vision of providing best of surgical care to all our patients. So we are the only dedicated surgical center of excellence in Northeast India, where every technology, technique which comes to the world or to the India, we make an attempt to bring it to our place. Yes, Swagat is known for endoscopic surgery, gastrointestinal surgery, laparoscopic surgery, robotic surgery, because most of these procedures were started by us. Apart from some of the newer treatment modalities like endoscopic treatment for fistula, endoscopic scarlet surgery for the thyroid, and all this. Now, apart from this, now in the last couple of years, Swagat has diversified, and we have many more specialties which has joined us. That includes the ICU and trauma care. The ENT department is fully fledged, being managed by my wife, Professor Swagata, and the accident and trauma wing is very strong. Cardiology wing is very strong. We have one of the best cath labs in the Northeast India, and which is almost same like any other hospital in the mega city or of Guwahati. That's a brief about Swagat super specialty hospitals. Swagat is also known for robotic surgery where we can do any advanced surgery of any part of the body, starting from head and neck to the rectum, colon, to the thyroids, to the chest, and to the abdominal organs.
Sir, we would also like to know about the liver and liver transplant. How it
Thank you again. Liver is one organ which is very important for us, for each one of us. It helps in detoxifying toxins. It is a storage for vitamins, storage for many elements, and it secretes bile, which helps us in digestion, which breaks the proteins of what we eat, and also helps in absorbing the fat in the food. Liver may get damaged due to various reasons. That includes the most common cause being various types of alcoholic damages, what we see in India, particularly in our part of the country. The alcohol alcohol intake has been increased. We have seen sudden surge in intake of alcohol by the population, by the society, and this is one cause. So apart from alcoholism, the non-alcoholic liver diseases are also coming up, where due to very rich fatty diet, a patient may develop fatty liver in the beginning, and later on it ends up with a cirrhosis of the liver, where the liver gets fibrosed. We call it fibrosis, but actually it means it's a scarred liver. The liver becomes very hard. Then there are various types of infections, hepatitis B, hepatitis C. They also end up with liver failure. Apart from this, we have some diseases which may be there since birth. The patient may be born with such diseases like hemochromatosis, and patient may have a cancer or a metastasis in the liver, a cancer of the liver where the liver may be eaten up completely, and or it may be a polycystic liver where the liver is completely become like a multiple vacuums like cysts in the liver, and this liver fails. So liver has a very a high regenerative power. It can grow. So even if 70% of the liver is removed, that rest 30% the patient can survive, and it can also grow in the next 2 to 3 months to look like a normal liver.
Sir, we would also like to know what is liver transplant.
Well, I presume transplant is known to at least most member of this society, most educated member of this society. Transplant is when we give one particular tissue or organ to from one human being to another human being. This may be the one of the small example is giving blood transfusion to someone. You are giving your cells to someone. So basically, a liver transplant is when one liver is given from one particular person to another person. Now, liver transplant can only be done and is only done when the patient has a end-stage liver failure. End-stage liver failure. Now, liver is completely gone. Patient cannot survive. He doesn't have even 30% of the liver. So here comes the role of liver transplant. There are various types of transplants. We can take liver from a living donor, and we can take liver from a cadaver donor. Cadaver donor, we call it deceased donor. So a living donor can be either a family member who is blood relative, a first family or a second family member, second generation family member, preferably a blood relative, a brother, a sister, a parent, a son, a daughter. But normally we take liver in the adulthood, from the starting from 80 years to 50 years of age. When you're asking about liver transplant, so apart from the living donor, where a donor can give a portion of the liver, as I said already, 30% of the liver is needed for managing your day-to-day activity, your life. So one can donate 50, 60, 70% of his liver, and this is for living donor. Now, if a person has sudden brain death, he has a major brain injury for which the person has a brain death, but his organs are surviving. His heart is pumping, he is breathing, his kidneys are working, he is urinating. So such type of things happen. So such patient, for once they are declared dead, if they have, there's a rule of 100 we call it. If he's maintaining pressure, if he's still secreting urine, if his oxygen saturation is normal, then we can take the liver from such donors for transplantation to a healthy donor within a couple of hours of his declaration of brain death, and which is declared by a particular society committee of members, or committee formed of several members.
Sir, what about the Swagat Hospital transplant team, and who all are the team members of the team?
Thank you. Whenever we talk about transplant, the common transplant which are happening are the kidney and the liver in the country. Kidney, particularly the procedure has been comparatively easier because a person has two kidneys, so anyone can donate a kidney, and with the one kidney he can survive. So this is very easier compared to the liver transplant. So in Northeast India at present, there is one center which has done about 2 or 3 transplants in the last couple of years, about 7, 8 years, but the transplants are not happening, and Swagat is the second center which has been given approval for transplant of the organs, but we particularly would look into the transplant of the liver only. So we are the only second center which has got approval of the central and the state government for transplant, apart from the medical colleges where the transplant is going to happen, where kidney transplant are regularly happening. liver transplant probably in medical college does not happen, and they must be having a license. I'm not sure about that, but as per my research, it seems that there are only 2 centers having their license at present. Thank you. The team, when we say transplant of the liver, the team includes the surgeon. I'm the overall in charge, but this surgeon or a decision maker. Then transplant surgeon, we have tie up with various centers, but our own transplant surgeon is Dr. Basant Mahadevappa, who does some of the advanced liver surgeries. Liver surgery doesn't mean only transplant. You need various advanced surgeries, which I also do robotically, and he also does. He does most the transplant work. And then we have our own gastroenterologist, which is a part of the transplant team. A psychologist is a part of the transplant team. Transplant team must have a dedicated anesthesiologist and a anesthesia critical care specialist. My son Ayushman has been trained, and he is there with us. And apart from this, in transplant you need many approvals, many examinations, and that includes the ENT surgeons, the anesthesiologists, and as I said, the psychologist, and a hepatologist or a gastroenterologist, but preferably a hepatologist. Apart from this, we need a complete team of scrub nurses and OT nurses, which are all trained and ready and are there to help the patient who needs a transplant.
Sir, what about the Swagat Hospital transplant team and who all are the team members of the team?
Thank you. Whenever we talk about transplant, the common transplant which are happening are the kidney and the liver in the country. Kidney, particularly the procedure, has been comparatively easier because a person has 2 kidneys, so anyone can donate a kidney, and with the 1 kidney he can survive. So this is very easier compared to the liver transplant. So in Northeast India at present, there is one center which has done about 2 or 3 transplants in the last couple of years, about 7, 8 years, but the transplants are not happening, and Swagat is the second center which has been given approval for transplant of the organs, but we particularly would look into the transplant of the liver only. So we are the only second center which has got approval of the central and the state government for transplant, apart from the medical colleges where the transplant is going to happen, where kidney transplant are regularly happening. Liver transplant probably in medical college does not happen, and they must be having a license. I'm not sure about that, but as per my research, it seems that there are only 2 centers having their license at present. Team, when we say transplant of the liver, the team includes the surgeon. I'm the overall in charge, but this surgeon or a decision maker. Then transplant surgeon, we have tie up with various centers, but our own transplant surgeon is Dr. Basant Mahadevappa, who does some of the advanced liver surgeries. Liver surgery doesn't mean only transplant. You need various advanced surgeries, which I also do robotically, and he also does. He does most the transplant work. And then we have our own gastroenterologist, which is a part of the transplant team. A psychologist is a part of the transplant team. Transplant team must have a dedicated anesthesiologist and a anesthesia critical care specialist. My son Ayushman has been trained, and he is there with us. And apart from this, in transplant you need many approvals, many examinations, and that includes the ENT surgeons, the anesthesiologists, and as I said, the psychologist, and a hepatologist or a gastroenterologist, but preferably a hepatologist. Apart from this, we need a complete team of scrub nurses and OT nurses, which are all trained and ready and are there to help the patient who needs a transplant.
Sir, we would also like to know what is the status of cadaver donor in Assam?
Cadaver donor is the need of the hour. We have huge demand of liver donations, kidney donations. There are many people in the wait list. People register their names, they keep waiting to get a donor. So there are many centers where the accidental deaths occur, and the people, those people who die, their organs can always be taken to save many lives. A deceased person can donate both the kidneys, can donate his eyes, can donate his liver, can donate his lungs, can donate his heart. So he can save many lives provided he has given his consent for donation when he's alive. At least I have given a consent that my organs can be taken after my death if and I need, because I'm not been there to be asked for. So while they are alive, they should give a consent and pledge that they should donate. So, but unluckily, Assam, we have not been having such cadaver donations in the last 3-4 decades. We have not seen. I've just heard that last week some cadaver donation has happened of the cadaver donations of the kidney has happened in medical college, but there is no authentic news in the media. I'm not very sure. There is no press release issued by the medical college, but I've just heard. So it might have started, but then we need a long way to go to really save many lives of the people who need a cadaver liver donation. But then it seems the government is very active now, and government has almost decided so to have more and more cadaver transplants in our part of the country, at least in our Assam state.
Sir, can we also do that?
Yes. Any center which can do a liver transplant can also take a liver from a deceased donor. Now, if a person ceases to leave his brain, then he can always donate. Now, in such patients, we get very few hours. For kidney we might get 24 to hour, more than 24 hours, but for taking a liver from a deceased donor, we get only about 12 hours of it, or a little more than that maybe, and we have to rush very fast. So here permissions and all must not take much time. On the spot sometime, at times without permission also we may have to take. It is only the consent of the family members at times, and the committee, hospital committee, can also take a call. In most of the cases, permission process takes little longer time because it's a very sensitive issue. Just taking it, many things are hard about the people buying the organs from unrelated donors. That's why government is very careful. But in a deceased donor, there is hardly anything to worry, because the patient is to be declared dead by a team of several people are involved there. That may involve surgeon, neurologist, psychologist. We can so it becomes I think a cadaver or a dead donor is the answer to saving the lives of many people needing liver transplant.
Sir, what happens to a patient with the liver failure?
Liver failure present A patient with liver failure presents with weakness, thinning of the muscles, fullness of the abdomen, and fluid, and a lot of fluid comes in the abdomen. Abdomen becomes protruded. Uh, he also may have very prominent veins. We call it spider veins in the abdomen, and that's it. And because of the fibrosis of the liver, there is a back pressure on the blood supply to the liver, and that causes blood vomiting. So starting from weakness, indigestion, different jaundice, thinning of the muscles, protruded abdomen with fluid in the abdomen, to blood vomiting or to passing of black stool, that means passing of blood in the stool which becomes black. All these are signs of liver failure. So patient presents is any of these signs to us. Many of the people need a repeated withdrawal, aspiration of fluid. They keep coming every third day, fourth day for taking the fluid out from the abdomen. Otherwise, it causes loss of breathing difficulty to these patients.
So, we would also like to know how does the liver get diagnosed, and if we can take a liver from a living, human being.
Liver diseases and liver failure, this is what you're asking, is diagnosed by clinical examination. When we examine the patient from history, from his from his past history of taking alcohol or overeating, and then on clinical examination, we get fluid in the abdomen, wasting of the muscles, jaundice, and in the blood and routine examination, we get various signs of liver failure. The enzymes may be raised, the body protein, as I say, there is indigestion, proteins are not being absorbed. So there is a very low level of albumin in these patients, with all signs of malnutrition in these patients. So clinically we diagnose, we confirm with routine blood test, we confirm with sonography, we confirm with we call it a Doppler study, where we can see the blood supply to the liver. Because the liver is scarred, the blood supply may become maybe is under pressure, and then it gives a back pressure to the vessels, and the patient may come with huge spleens. We call it splenomegaly, enlargement of the spleen, shrinkage of the liver. Initially, because fatty, later on liver shrinks when it is damaged. And then these patients also have, we do routine endoscopy in these patients to rule out the back pressure in the vessels, in the food pipe. We call it varices. This is one of the commonest finding, apart from the ascites or the fluid in the abdomen. Varices is a common finding in end-stage liver failure. So depending on the stage of the liver failure, we get different types of clinical picture in these patients. Second part of your question was, uh, can we take liver from a living human being? Now, of course, yes. I think this message should go to all the members of this society, that liver can regenerate very nicely. Any person can live with 25% of his liver. If 70% also is damaged, still he can live a normal life, and the liver can regenerate. So any living human being between the age of 18 to 50 years of age can give a liver, can become a donor, provided he doesn't have some of the rare diseases where the liver cannot be given. Normally, we prefer a donor for a recipient who's going to receive must be of same blood group, preferably, or else we have to do an RHA typing and a lot of many things. So that's it. I think there are not very strict criteria that they should not be there, but then a person should not be having any history of cancer in the body, in other parts of the body, and his liver should be healthy, of course. So we have certain assessment of the liver where we do CT scan, CT scan, and when we do various types of MRIs to see is a donor's liver, is the anatomy of the liver, of the ducts, and the blood supply of the liver is normal or very abnormal. Even if it is abnormal, a preoperative diagnosis helps us in planning his donation. So, so that's it. So, and then we also do his study for his scarring of the liver. We call it fibroscan study. So these are all parts of the protocol. There are several protocols which are followed when we plan a liver transplant, at least the donor. So any person who is healthy can donate a part of his liver. The liver donation does not mean a full liver, except when we are taking from a cadaver. When we take from a cadaver, we take the full liver. We might use for a split transplant. We might take half the liver for an adult, a smaller half for a child if you are taking from a cadaver. Usually for the adult, we take only a part of the liver, which depending on how much is required, and then we transplant it to only one person, mostly.
Are there any risks to the donor who will face?
Liver donation has always been very safe. Yes, the only thing is when compared to the cadaver donor, if a living person is going for donation, we have to have all the minor side effects of surgery. He has to have a scar. He may have a post-operative little bile leak for a couple of days. Normally, liver donation is very, very safe. There are hardly any instances of any major catastrophe for a donor. But then, when we take a consent, in there is a lot of complex procedure in taking the consent. We call it an informed consent. We inform the pay donor and the recipient all the steps of operation, what is we are going to do, what are the risks, what are the chances of failure, how are you going to live after the surgery, how what will be health. So a donor, when he gives, he has to be slightly careful, maybe for he doesn't need to take any medication once he have donated his liver, not a problem, except for the recovery after the surgery. He might need painkillers, antibiotics, vitamins. Otherwise, he can live a normal life 3 to 4 weeks after the surgery, and that's it. So we normally we don't find lot many complications in donor, and any healthy person can donate a liver.
Sir, we would also like to know how the surgery performed.
That's a very interesting question. I know everyone, every family member, every member of the society would like to know how we do the liver. So normally, it's two operation theaters running simultaneously. There are many members of the team working, running on both the operation theaters. Cadaver donation is not a problem. We take the liver and put it in a particular solution, and thereafter we can transplant to the recipient. Here, in a living donor, once we have opened his abdomen, he's checked his liver is healthy or not. We have already done his preoperative CT and MRI. So we check his anatomy, take a portion of the liver by special machines called sound cutting machines called KUSA. So we take a portion of the liver, immediately put it in the solvent where it remains safe for about 12 hours. And in this period, on the other side of the operation theater, in the adjacent operation theater, the recipient abdomen is open. This liver is now after particular solution. Now in the meantime, that side we have prepared the bed. That becomes very easier operation. We have to just save his all the blood vessels and the ducts, we call it bile ducts. We have to anastomose the artery to the artery, vein to the vein, duct to the duct. So there we also prepare the area where the transplant is going to happen, and so we take out the diseased liver and take this the portion of the liver and but connect all the blood vessels as a ductor. So with tiny suture materials. So that's how there are two teams working. That's how from the donor to the recipient the liver goes.
That was an interesting thing to know. Sir, thank you so much for your valuable time and the information which you have given to our viewers. It is our immense pleasure again, and I'm also very privileged to be sitting in front of you today. Thank you so much, sir. Thank you so much for watching the 5th health series of Swagat Hospital, Guwahati, Assam with Professor Dr. Subhash Khanna. For any appointments or queries of Swagat Hospital, kindly contact the following given number below.